Hello, everyone, and good morning. My name is Professor Regina Callion, and I am so excited to be at KPNA's 39th Scientific Conference. And I bring greetings from the United States of America. We are excited about your new opportunity to come here to be a US RN. And so you have heard many great things about the NCLEX exam and the opportunities for global employment. And so today, even among you, probably, there are some who have taken and passed the NCLEX. So, what we want to make sure is that you are able to find your personal pathway of success. We know that everyone's journey will be different, but indeed, the first step for everyone is making the decision to take up the opportunity. So, with my partnership with Kenyan Nurse Consultants, thank you, Paul, so much. Paul Simi, RN, for leading the charge in this. And KPNA, we have a global pathway that takes you right where you are in your home country here to the United States. Oh. And so we are going to get started in one moment with our worksheets and this NCLEX Masterclass. Welcome, everyone. Come on in. We are getting started with our masterclass again. My name is Professor Regina Callion, and it is a pleasure and an honor to be here as part of KPNA's scientific conference. This is the 39th annual conference, and what a great opportunity to demonstrate the capacity of the association with global growth. So, with my partners, Kenyan Nurse Consultants, and also KPNA, we have established a global bridge. And our goal for today is during the masterclass, if you have your worksheets that you will get them out. I have lots of notes to share as we prepare for the NCLEX exam. We'll talk about what is the NCLEX exam and how to position yourself to pass it in the least amount of time, because we know that time saves money. And here in America, we like to do everything fast. So if you're coming to this country to be a nurse, you have to understand the opportunity, but also the culture that we have here in America. I know that when I came to Kenya, one of the things that I appreciated is the strong foundations of the nurses. And I went to several of the universities and colleges and training centers. And I truly believe that the nurses are ready to pass NCLEX once we work on just a few of the processes and also the educational components of it. So NCLEX, just as much as a knowledge exam, is a culture exam. And we have your specific representative, Mr. Dickson, who will also be joining me on the live later. So shall we get started, everyone? Everyone's in class. Let's get started. Okay. One of the first things that I want to have you to consider is right now, what would it mean for you to come to the United States? This is the ReMar V2 NCLEX Masterclass. What would it mean for you to come to the United States? And in addition to that, what thoughts are holding you back from making the attempt? Is it self-confidence? Is it the ability to do all of the steps? You may have heard many steps, but I will tell you that fortune favors the brave. And in order for you to fully grasp the idea of leaving your home, leaving your comfort zone, you indeed have to decide to be brave. And I think that you can do it. I actually think that you actually are quite a speedy learner. But let's go into it. So for today, I want us to do something interesting, which is take a self-assessment. That's the very first thing that we are going to start with. And this self-assessment is quite simple. I just want to ask this question. Well, I want to say this statement. You are a fast learner. You're actually quite a fast learner. If no one has ever told you that before, okay? If no one has ever told you that before, you're a fast learner. Now, why do I say that? Why do I say that? I say that because if you think about some things, some of the most important things that you deal with on an everyday basis, you have learned them quite fast. For example, in your mind or on your paper, write down one thing you are afraid of or one thing that you really don't like. One thing that you're afraid of or one thing that you really do not like. For me here in America, one thing that I really don't like is spiders. I don't like anything that is creeping or crawling around, right? We have a lot of snow here in Ohio. It gets very cold, not like the weather. Some people don't like the feeling of change, right? Some examples of things that you may be thinking of in your mind. I can't see it, but maybe you're thinking this of your mind. Maybe when it comes to your world, you don't like the idea of quite leaving your family behind. You might not like the idea of not being successful. This was one that I saw online. There is this thing where you can send money to the wrong M-Pesa number. And that was something that people were worried about, right? So I'm talking about being a fast learner. And I'm bringing these things to the forefront because if you think about it, how long did it take you to learn this fear? Did it take you years of training? It did not take you years of training to learn that you actually don't like the idea of leaving your family behind, or you don't like the idea of not being successful. It did not take me a long time to learn that I do not like spiders, right? And so with the same mentality of doing the work to change your life, to take the NCLEX, it won't take us long if we focus our attention on the right things, because we are indeed fast learners to the things that are important to us. We drag out the process when it's not important to us. So we have to reframe things that are going to help us get to the next level. And again, your brain learns very fast. So let's focus on what your brain learns fast with. When I talk about the NCLEX exam, this is a very significant exam in your career. For those who choose to do it, it will position you in a different, not only in a different country, but also in a different opportunity space. And we have nurses here in the United States already from Kenya, already from Uganda. And when they come here, they find in a very short time, they are serving in leadership positions. Even for myself as a young nurse, I was trained under nurses from Nigeria, from India, from Kenya, from Haiti. And so international nurses play a strong role in the American healthcare system. I want you to be one of those nurses too. But we have to pass the NCLEX. So just for clarification, what is the NCLEX? The NCLEX is our licensing exam that allows you to work as a registered nurse in the United States. It is the highest level of the exam to be an entry-level nurse. So meaning you can pass the NCLEX and you can work in a hospital, you can work in a nursing home, if you work just with elderly, you can work in a plastic surgery office, you can work in research, you can work in cosmetics, but you have to take the NCLEX because you will have the responsibility of passing medications, much like you do in your home country. When we talk about the exam, we know that this is a computer adaptive exam, and that changes to you as you answer. The NCLEX exam is very unique because nobody gets the same exam. And so one of the reasons why we need to take you through a formal education process is because no one can really tell you what will be on your NCLEX. Even if someone has successfully taken the NCLEX exam themselves, that does not mean that they can prepare you for your exam. So we need to make sure that you go through a standard curriculum that will address all parts of the examination. And the test in computer adaptive means that it gets more challenging or more difficult based on your knowledge, not on anyone else's. And so this is very significant. And the NCLEX exam, you must use the proper technology in order to prepare. Okay, so technology and preparation go together. And right at KPNA, they have now my technology that will prepare you. We train over 100,000 nurses every single year to successfully pass the NCLEX. So what they are offering is the first class to passing the NCLEX. Another thing that I wanted to tell you is that the NCLEX is a safety examination. It allows you to demonstrate how safe you are. So, how do you do that? A brief overview of what you will learn when you go through the curriculum. Now, you'll be gifted with two gifts. Okay. One is the Quick Facts for NCLEX book. This is a short, to the point question and answer book that will help give you a foundation to this examination. Another book that you will receive is the V2 Student Workbook, because as part of your training, you will attend online classes that are pre-recorded and ready for you to study as soon as you make the decision that you want to get started. And what we say is the sooner you get started, the sooner you can get licensed so that you can be in a position to take one of our opportunities for U.S. employment. So you're going to get these two books plus the technology system. And I'm so thankful for my partners at Kenyan Nurse Consultants because they already have these books in your country. So you don't have to worry about paying customs or anything else. It's a big advantage. Now, the structure for the next generation NCLEX is this is a computer adaptive exam, also known as a CAT test. CAT stands for Computer Adaptive Exam Testing. The number of test questions that you are prepared to answer will range from 85 to 150 questions. 85 to 150 questions. Now, does that sound like a lot of questions? Actually, because this exam is computer adaptive, we are able to offer a shorter examination. So 85 questions is not a lot of questions for a licensure examination. Just a few days ago, I took the Global Nurse Certification exam. And this is an exam that a nurse takes to demonstrate that she is competent in all of the areas of nursing on a global level. That exam was 300 questions, and it was quite tedious. So here we are talking about 85 to 150 questions demonstrated by you for your competence. This examination allows you to have 5 hours, which is more than enough time. And that includes the ability to have breaks or tutorials. And again, my appreciation for the NCLEX has grown since taking the global nurse exam, which what I will say about that is you got no breaks and you only had 3 hours to take it. Now, the thing about the NCLEX is that this is the highest test for countries. So in order for you to work in the United States, everybody has to take the NCLEX. In order for you to work in Australia, because you come from a different country, you have to take the NCLEX. And it's the same with Canada. So everybody is interested in the NCLEX exam because it opens doors for you. And I have nurses that are in Canada and they say, I passed the NCLEX. I want to come to the United States. And it is such an easier process for them because they have this exam. So even though the United States is my number one favorite country, if you choose to go to Canada or Australia, you will still find great opportunities there as well. The scheduled breaks that you get, breaks are so important when you're taking a high stakes exam. So on the NCLEX, you're allowed 2 breaks. After 2 hours, you're able to take a break. And then again, after 3.5 hours, you are able to take a break. So know that going in, as you are preparing for this exam, there is a way to pause it, regroup, and come back to it. But what we find is that when you know the information, you are able to sit down and pass this test, and you may not even need any breaks. And so our hope for you is that the preparation that you do allows you to take the NCLEX exam successfully and pass it on the first time. The scoring is a pass or a fail. So you are not trying to get 50% or 70% or 80% on this test. You are trying to consistently pick the safest answer so that you can receive that passing score. Now, what are some differences in how the NCLEX is approached? Most of our nursing exams, traditional, in school, are nurse focused, meaning we are trying to evaluate what you know, what you have memorized. For the US based exam, because the level of responsibility in nursing here is so high, and nurses are considered the protection of the patient, the NCLEX exam is patient focused, meaning it does not matter so much what you have memorized, but what we are looking for is how you apply your knowledge to the care of a person. And that person will be in many scenarios, many situations. You will be doing case studies to demonstrate that you can follow a patient from the time they enter the hospital to the time they are discharged. And so it is a very unique presentation of an exam. On traditional nursing exams, you know that you are looking for the one answer that is correct. And usually you're able to find that one answer. However, what makes the NCLEX exam challenging is that all of the answers are correct. And what we are looking for is that you know how to prioritize the most correct answer. And that most correct answer will be based on the situation. So, yes, indeed, all of the answers can be correct, but which one is most appropriate? And so that's why we spend so much time looking at the information so that you can make this. It's like a pivot in the way that you think. Another thing about the NCLEX, and I mentioned this before, is traditional nursing exams, even the ones that I took in nursing school, they do test quite a bit of what you remember. However, for the NCLEX, it is looking at how you reason when a situation is unfamiliar to you, how you reason when you have two acutely ill patients. How do you decide which one do you see first? We're going to go over some practice questions in just a bit where you will be able to, right now, today, see how you would do on your NCLEX exam. So I'm excited for that. Traditional nursing exams, they reward knowledge, root memory, basic application. Where US NCLEX exam, we are going to look at your critical thinking, and we're going to evaluate and reward your ability to critically think. With traditional nursing exams, you take one exam per country. However, with the NCLEX exam, you are taking one exam for several countries. And we're actually anticipating that the NCLEX will be adopted by even many more countries very soon. So, what happens when you climb the NCLEX ladder? There's a reason that you are sitting here today hearing about this opportunity. It is not by mistake. There is something that is happening in nursing, that doors are opening up on a economic and a global perspective. And so every nurse here has a specific calling to grow professionally and take advantage of this global opportunity. I was on a meeting yesterday with a company in Nepal, and they have nurses that they are training in India. And right now, they are training hundreds of nurses in India to prepare to launch in the United States. However, there are many challenges, as you can imagine, preparing the nurses, because English is not a native language. But they see the opportunity is so significant to their country and to the people that they are willing to do the work of learning a new language. They're willing to do the work of reading and writing in that language, and ultimately preparing the nurses for healthcare in the new country. Oh, when I think about Kenya, how many advantages you have to the rest of the world. And I am not sure if everyone understands the positioning that they are already afforded. And so I want you to understand that you are closer than you think when it comes to passing the NCLEX. But the question is, do you see it for yourself? So what happens, what changes happen when you climb the NCLEX ladder? I say your view changes, because you are able to see more parts of the world that God created. And you're able to go into the world that God created with a ministry to help others. Also, your income changes. And that is a known fact that here in America, in nursing, it is one of the highest paid career fields that you can enter. And so when you become a nurse, you are going to find that your financial troubles disappear. And the reason why they disappear is because here in America, you are paid based on the problems that you solve. And so the bigger the problem that you solve, the more money that you make. And with nursing, because you are doing something that we value so much, which is our healthcare and our access to medical treatment, you will be compensated for your knowledge. Another thing that changes is the opportunities. So yes, you may come here thinking that you will do one level of nursing, but very soon you may be elevated to a higher station. And so this step of passing the NCLEX, we believe will yield abundant fruit in your life. And we are well aware that when you do something difficult and challenging, there is a reward that you're blessed with because you've done the thing that most people don't want to do. So many things change when you climb the NCLEX ladder. We have to not just talk about the possibility of NCLEX and passing the NCLEX, but we need to also prepare you for it. And so you may have heard this before, but I have viewers that are online that need to understand that what we are offering is a complete NCLEX training program. And so with the ReMar V2, that is our virtual platform, you are going to get video lessons, you are going to get computer adaptive practice questions, and a clear study schedule. I told you earlier that you were a fast learner, and I know that this process does not have to be a year-long process. Right? We have seen nurses pass the NCLEX in just a few months. And so you're not going to be guessing at all what you are to do. You will be told what to do. And by that, you will learn faster and your preparation will be stronger. So our challenge to you is to take up this process so that you study smarter, not longer. There are 3 layers of how you will master the NCLEX. There are 3 layers on how you will master the NCLEX. The first starts with building your foundation. So you are going to get the content in the video lectures and the 2 books. That is how we're going to start. And then once you get that level in your hands, in your phone, in your home, okay? And I'm going to talk about, I have questions here. I see, how do we get in access to it? I'm going to bring in your contact person. You have a direct contact person through KPNA that will help you to enroll in the virtual trainer. Yes, even your own personal concierge. All right. And so we want to make sure that this gets in your hand very quickly and very easily. So yes, the foundation will be set for you. And then what you're going to do is you are going to go through the information and you will begin to take practice exams. You will begin to take mini application questions. And this is so helpful to make you feel comfortable. When the time is right, you will feel like you have already taken the NCLEX. And that's the advantage that we are presenting with you. We are not going to be studying on paper and pencil for the test questions. And I know some people may say, oh, you can just study on paper and pencil. Oh, you can practice in a book. You can watch videos online. And you can do 100 of these questions on the paper. But what I'm saying to you is the exam is a technology exam. The exam is a computer-based exam. And so in order for you to be comfortable and in order for you to be appropriately prepared, you need to be studying on the computer. You need to be studying on the computer. And so we're giving you the best of what we know that helps. And then finally, because we are looking for your critical thinking and your clinical judgment, we need you to be able to demonstrate that during the training. And so how we do that is case studies. Over 85 case studies. And if you do all 85, the NCLEX will be easy for you. If you practice doing it in this format, you will be able to clear the NCLEX exam and pass it. You'll be able to write the NCLEX exam easily if you do the training. And so Let us try now to see just how close you are. Some of you have never studied for the NCLEX exam, but you are a nurse and you have a strong nursing knowledge. And so this is an opportunity for us to do some questions together. I don't have many, but what I want to do is show you your capacity for success in this area, because I believe that God has given us dominion over all of the earth. And that includes the knowledge here to help make us healthy, to help make us wise, and also to help us recover when we encounter disease processes. So, are you ready to start the first question? I think that we are. Let's begin. Here's a question. Which client should the nurse assess first? We are doing NCLEX practice questions. This is the ReMar V2 NCLEX Masterclass. Here's the first question. Which client should the nurse assess first? Client A, a gunshot wound with active bleeding. B, a stroke patient with no gag reflex. C, a diabetic client with low blood sugar. Or client D, an asthmatic client with mild wheezing. And this is a very, very safety-based NCLEX question. If you are able to clear this one, you are already in a great place. And I see comments on the screen already from our online viewership. That's great. Thank you for participating. Let me say this. If you get this question correct, then you understand some of the principles of prioritization. If you don't get this question right, then you know that you're a student and you still have learning to do. All right. And that is what we want. We want you to be open to learning right now. I actually want you to get questions wrong now so that when you take the exam, you will get the questions right. So shall we look at the next answer? Let's go. B, the correct answer is B. Now, why is this so important for us to know? And I did this question because it is one that even nurses here in the United States sometimes miss. They sometimes miss this one. And remember, when we are looking at all the patients, we start by understanding that those who have breathing problems or airway problems are going to be at the highest priority because you need oxygen to breathe. So airway is a priority. And if you have a patient and they're not able to have that gag reflex, listen to me, yes, they're not able to have that gag reflex, then that means they don't have a protected airway. That means that if they eat something or they drink something, they can aspirate. And so when you see no gag reflex, that is a big indicator, even when it is against patients who have asthma. This patient, many of you pick D. D is an asthmatic client with mild wheezing. Ah, well, we expect wheezing in a patient with asthma. Is that correct? We expect wheezing, and it is characterized as mild. The diabetic client with a low blood sugar is a concern for us. However, there is no indication that they have an airway issue. Number one, a gunshot wound is trauma, but right now, do they have an airway problem, a breathing problem, or a circulation problem? The gunshot wound with active bleeding has a circulation problem. And so we would not elevate circulation over airway. So our correct answer is patient B. All right, let's try another question. Our next question says this. The nurse is caring for several patients. Which client should be seen first? Another priority question. Here are the patients. Number one, A client with watery diarrhea for 2 days who reports dizziness. 2, a client waiting for pain medication after an appendectomy. 3, a client 2 hours post bronchoscopy with mild throat discomfort. Or 4, a client scheduled for discharge teaching on hypertension. What saith you to this priority question? Now, these patients are slightly more complicated, but we need to figure out what is their current situation. I think we're doing better. I think we have gotten better. From what I see, we are all on one accord, and most people are saying it is number 1. Some people are saying, I'm not sure. Is it 1 or is it 3? Is it 1 or is it 3? The correct answer here, have you gotten your answer? It's important when you are taking an exam like the NCLEX to choose your answer and commit to it. Don't get into this situation of going back and forth, or maybe it's this, or maybe. Don't change your mind. Go with your first answer and stay with it. It's a good habit to do. The correct answer here, if you chose number 1, you were correct here. Why is it number 1? Because your patient for 2 days has had an issue where they are losing fluids. They are losing water in their body. And now they are reporting what? An abnormal assessment. They are reporting dizziness. So that is why 1 is better than 3. I saw a lot of you go for 3 because I wrote that they had throat discomfort and that they had a procedure, right, down their airway. And so I was able to distract you. I was able to trick some of you just by those words. And so when you talk about the NCLEX, the exam is written with very good distractors. And so that is why us doing practice questions is important, okay? Because now that I have revealed the right answer, most of you are saying, I knew that. I knew that one, but you may have gotten distracted. So we have another. Let's try another one. A longer scenario. Let me tell you something. Be prepared to read. Be prepared to read. There's a lot of reading for the NCLEX exam. All right. It says this: a nurse in a U.S. hospital has cared for a patient for 5 days. On discharge, the patient gives the nurse an expensive gold bracelet and says, please accept this. Which response is most appropriate? Number 1, decline the gift and tell the client you can only accept food gifts. 2, politely decline and explain that hospital policy doesn't allow expensive gifts. 3, accept it, but ask the patient to write a note. Or 4, accept it, document it, and tell the charge nurse. What is the most appropriate thing to do here? And it is quite common for the patients here to purchase gifts for the nurses. And depending on where you live, those gifts can be quite expensive. For example, if you are in California and you have and you are in the celebrity area, some of those patients will do nice, kind things. So what is the correct answer here? Some people are saying, I don't know. I don't know what to do. Some people are saying, I'll take it. People are saying, 4, the patient gave you an expensive gold bracelet. What's the thing to do? And that's, I want to say this too about the NCLEX. Let me reveal the answer. 2, politely decline and explain that the hospital doesn't allow expensive gifts. One of the things about the NCLEX is that it is a US-based exam. And so that means that the scenarios presented in NCLEX, many people have never been in before. And so that is why it's so important, because with the new exam, these environmental issues are addressed. And so how do you respond if a patient gives a gift to you? We as nurses say, depending on what the gift is, okay? Because some patients bring food into you, some patients will create things for you. And so there is a way that we handle those types of situations. All right, let me move on. We'll talk more about it later. When you do the training, we'll be able to go into all of the things that matter. Okay, here we go. Question number 4 is this. A 16-year-old in a U.S. clinic is confirmed pregnant and says, "Please don't tell my parents I am pregnant." Which action is most appropriate by the nurse? Number 1, tell her the law requires the nurse to inform her parents. 2, promise to keep the pregnancy secret. 3, call Child Protective Services to remove her from her home. Or 4, check the state policy, then plan with her when to tell her parents. This is another scenario that is common, and there is an appropriate way to handle this. But I want to see what you say. What should the nurse do? Should she tell her the law requires her to inform her parents? 16-year-old. 2, promise to keep the pregnancy a secret. 3, call Child Protective Services, as this child is in danger and should be removed from her home. Or 4, check the state policy, then plan with her to tell her parents. And already I see there is a divide between 1, tell her that the law requires her to tell her parents. Or 4, check the state policy and then plan with her. Oh, I apologize there. It seems like I lost my video feed. Let me get back to where I was. Yes, I am getting back to where I was. I apologize. Let's see here. Yeah. One second, please be patient with me. Okay, here we go. All right, we are back. This is a live class, and this is one of the benefits of having the international pathway. Okay, all right. So I saw the answers between 1 and 4. The correct answer here, some people even picked 2. The correct answer is number 4. In the United States, once a teenager becomes pregnant, then they have the opportunity to emancipate from their parents, meaning that their parents no longer make medical decisions for them. And so the states, there are 50 states in America, and there are 16 territories that the United States owns. Once a teenager has become pregnant, then that teenager can be considered an adult when it comes to medical care. So you have to check the individual state policy, then plan with her to tell her parents. So again, cultural things matter in the healthcare system here. You're going to be dealing with many different cultures, many different religions. Yes. Question number 5 says this. A doctor who is a patient in the hospital says, My home pills are better than the pharmacies. I'll just take them and you can chart that you gave the hospital medication. It is the same thing. What is the safest response by the nurse? Number one, allow the doctor to take his own pills as they have prescriptive authority. Two, report the situation per hospital policy. Three, put the bottle with the client's bedside medications. Or four, chart that the medication was given and closely monitor the doctor. You have a doctor and they want to give their own medications to themselves, but they want the nurse to chart that she's giving the hospital medicine. What's the safest thing for the nurse to do? What's the best thing for the nurse to do? I see it already. Very quickly, everyone is on one accord. They say, we're going to report this situation per hospital policy. And this is very good. Let me say why this is very good. Because when it comes to the United States, you have to be able to speak and advocate for the patient, but also for yourself. And that is being able to speak up to anyone who is violating it. Some nurses, when it comes to doctors, they shrink down and they don't want to speak out, but it is important that you protect your license because you work very hard for this nursing license. Is that right? And so you have to be willing to protect it no matter who you have to speak against. You have to be able to do it professionally and follow the hospital policy. And so I trust that you can do that. Here's our next question. And we just have two more. A client's Apple smartwatch shows a heart rate of 42 beats per minute. The heart monitor reads 68. The nurse hesitates which to trust. What is the best action of the nurse? Number one, remove the smartwatch. Two, manually assess the heart rate. Three, document both readings. Or four, ask the client how accurate the smartwatch is. We are live from KPNA Scientific Conference. Thank you so much for allowing me to be a part of this amazing experience. This is the ReMar V2 NCLEX Masterclass hosted by myself and Kenyan Nurse Consultants, my partner. On this global pathway, we're training you how to become a US RN the fastest way possible using ReMar V2. So I see the answers coming in. I asked a simple question. Your patient is wearing an Apple smartwatch. Most patients here in the United States have smartwatches, right? I just have, mine is in the other room. And the smartwatch says a number, but the hospital heart monitor says something else. What should the nurse do? What should the nurse do? Again, I see us all on one accord. It looks like everybody's saying 2 and 2 is right. Manually assess that heart rate. We want to verify manually before assuming an error. So over trusting or ignoring devices, it reflects doubt, not judgment. And so anytime you doubt, you need to do what is right, and that is use your professional training to clarify. All right, here's the last question. I believe it's the last question. Give it a try. The nurse receives 4 clients during a night shift. Who is the priority for immediate care? Who's the priority patient here? Number 1, a client with asthma complaining of shortness of breath. 2, a diabetic client with a blood glucose of 340. 3, a post-op client requesting pain medication. Or number 4, a patient with pneumonia who has a productive cough. Who has a productive cough. Who is going to be our priority here? Many patients are up, but only one patient is the priority. And this is a scenario where all the patients need to be seen. So there's not one healthy patient here, but who is your highest priority? I see some ones, I see some twos. Oh, this is a good one. I see some ones, I see some twos. And the reason why I'm putting these questions in front of you is because they test your foundation. They test your foundation. And isn't it great that with KPNA collaborating with ReMar and Kenyan Nurse Consultants, we can share our nursing knowledge in many different ways now. So this is actually a historic class, and you're right here in the middle of it. The correct answer here is going to be absolutely number one. It's going to be absolutely number one. Now, when you do your training in V2, let me show you this. And of course, this patient has an airway problem. This patient has an airway problem. And that is why this is our priority patient. So let's look at the other patients. Number one has an airway problem. Number two, a diabetic patient with a blood glucose of 340. What kind of issue do they have? Is it airway? Is it breathing? Is it circulation? They have a circulatory problem. Yep, they have a circulatory problem. Number three, a post-op client requesting pain medication. Well, this patient doesn't have an airway, breathing, or circulation problem. This patient has a psychosocial problem. And then the patient with pneumonia who has a productive cough, this patient is not having any complications. They're having expected signs and symptoms. Oh, wow. So at this time, one of the things that we'll do is prioritization. So I wanted to show you in the book how we are going to go over all of the most important topics. And I'm looking for prioritization, but I see this one, EKGs. So we'll have a whole section on cardiac. And when you are filling out this workbook, you will see that most of the work is done for you. So when you open the book up, you'll see that the structure is already there. And all you're doing is taking notes while you are going through the video course. Oh, I see somebody says, I got a 7 out of 7. You got all 7 questions right. I think you're on the right track. And so prioritization, I want to look at prioritization. Prioritization is one of the issues that we have to address. And it comes at the back of the book. So you have delegation and assignment, and then you go into prioritization. So this will be a great part of your training. Everyone should start here with this book. Now, you will also get access to quick facts for NCLEX. And one of the things about quick facts for NCLEX is that the medications that we use in the United States are a little different from the medications that you use. And so we want to make sure that you know what we call our medications, because the classes are the same, but the names may change. And so in the back of quick facts is this. This says pharmacology section. And these are the top 200 drugs that you must know for the NCLEX. Okay. So how important is this book? And I'm looking around because what I had was I had another book, and it's just to show the difference between quick facts and another book. So here's the other book that I have. This is a book for pediatric nursing and all of the pediatric nursing conditions. And this is just one book on one subject. So when you talk about quick facts, this is all the subjects here in one book. So take the right one. We'll be having these available for you too. Both of these books will be available. Now, many of you have asked me, well, how do I get started with the training? What is the process for the training? And this is when I want to bring in your personal consultant, KPNA representative, Mr. Dickson Aruasa, and ask him to come on. So if he turns his camera on, we'll invite him in I know he was here earlier. Also want to just go over, here's the secret of passing the NCLEX. All right. The secret of passing the NCLEX is not knowing everything. You don't have to know everything, but we want to train. Okay. We want to train your brain to see patterns. And so, what KPNA is doing is bringing the bridge to you, making it so easy for you to take up the NCLEX training. And then our partners with Kenyan Nurse is they're helping you with the processing part, because NCLEX is one part of the journey, but you still would benefit so much from knowing the other steps so that your pathway to the United States is straight to the point. Is straight to the point. And remember, the questions that I presented today were actually quite introductory. And my goal for you is, as you go through the training, okay, as you go through the training, you are able to take on the more challenging questions and we're able to talk through it. And so I'll be your personal coach throughout this training process. It's a huge benefit at every level. You have KPNA to give you access to the training. I'll be there to coach you for the training. And then, of course, the representative at Kenyan Nurse Consultant will help you sign up for the NCLEX, help you get your transcripts in, help you prepare for coming to the USA. So if everything is in one place, what is your responsibility? Your responsibility is to make sure you don't leave here. You don't leave here without having all of the information. Because once we close out this class, then it'll be up to you to take this first step. Okay. So now that we finish, okay, now that we finished the session, I don't want you to leave without knowing how to get access to the V2. I don't want you to leave without knowing how you get started, because I see people asking me here, am I doing the training? Am I doing the coaching? Yes. All right. What we're saying is that with the V2, you'll be doing the training with me. We will be doing study sessions together. We'll be doing study sessions inside of the V2, which is something new. So you'll be able to do the remediation study sessions personally with me. And we're going to do it so that this process is done quite speedily. So I'll invite Mr. Dickson to come in. I want to know how the conference is going and what is the next steps that the nurses will take. I see, as we prepare for that, I see some questions here. Is this program operational in Cameroon? Absolutely, it is operational. We have the books already. They will come from Kenya and they will be able to be shipped directly to you. They will be able to be shipped directly to you. And so this is part of the pathway that we've created. Am I new here? What did I miss? Well, we are now live from KPNA's 39th Scientific Conference. And what we have done is we've just launched our partnership where we are talking about how you can prepare to take and pass the NCLEX exam, so that if your dream is to come to the United States to be a USRN, you are able to do that now through this partnership. And one of the things is, when we talk about coming to the United States, we understand that this is an opportunity for professional growth. So I don't necessarily expect you to come to the United States and live in America for the rest of your life. What I expect is for you to be open to coming to America, even if it is just for 2 years or 3 years or 4 years, and then being able to learn in our environment, being able to take what you have earned and take it back home. That's what I traditionally see happening. And I see it happening in the Philippines, and I see it happening in Saudi Arabia. And so I also know that there's an opportunity here. Okay. Ma'am, will I get a hard copy in the UAE if I am enrolled? Yes, you will. With this partnership, we are able to send the material everywhere. We are able to send the material everywhere. And so, again, this means that we are opening doors globally. And there is no barriers. There is no barriers for who can join our program, and there's no barriers for this opportunity. So right at the bottom of the screen, you will see if you are ready to get started today and you are ready to have your training and you have learned that you are indeed a fast learner and you can get started, you can now, I'll read it to you. You can now go through NCLEX through Kenyan Progressive Nurse Association. The email is down below here and the WhatsApp number is there. Does everybody see it? I'm so glad that you do. And I know that we are expecting many signups. And again, it does not matter if you're from Nigeria, if you are from Ghana, if you are from the UAE, these opportunities are here for you. And so that training that I talked about, because this is what you'll be asking for. You're going to be asking for the ReMar NCLEX V2 training package. That is what you're signing up for. And that is going to come with the 2 books. I see him now. That's going to come with the 2 books. And also that is going to come with the technology. Okay. That's going to come with the technology. And the good thing about it is when you go through this course, you are going to have 6 months access to the training. So is it enough time? It's more than enough time. And they have something that I don't even have. So let's bring in I think I have, I know I have Mr. Dickson, but I think I have the president also, but let's bring him to the stage. Welcome to the masterclass.
Thank you, Professor Regina. We are so grateful for the presentation. And we are doing well in the conference, and everyone is interested with NCLEX. I think you brought it in the simplest way that everyone is interested to do it. So we hope our nurses will enroll. And so I want to welcome our president so that he can tell us 1 or 2 words. It is becoming dark here.
I see.
It is evening, but yes. I think we are visible. So I want to welcome our president, Michael Nyongesa, so that he can speak to our nurses. Thank you.
Welcome.
Thank you so much. On behalf of KPNA, I wish to say that this was awesome. It has added a lot of value to our conference, and it has added a lot of impetus to KPNA members who have been able to go through this masterclass of NCLEX. This can only be strengthened. This is a relationship you cannot bring to an end because of the goodies and the important information and the important learning we are going to look forward to. So I wish to tell to our members that wherever you are, this is the way to go. You can find time to register and be part of this program and learn. Opportunities are many when you have an NCLEX certificate. So even those who are not our members, wherever you are listening to us and seeing us and watching us, you can still register to be a class. And as KPNA, we promise to guide you through the process that you can be able to be USRN. So, Professor, I wish to say thank you. I also wish to say thank you to our members and our members who have listened to this program. And we look forward to doing even better than we have done today, that our people may benefit, especially Africa, when it comes to issues of training for NCLEX, for them to increase their opportunities. Thank you so much, and God bless you.
Thank you so much. You have heard from the president of KPNA, and what he said is that this opportunity is so important for the membership to take advantage of. And at this current time, you have the ability to leave the conference with a connection to your U.S. nursing license. Oh, how wonderful it is. And he's right. We will come back. We will do even more opportunities for learning and training. We had such a wonderful time today. And so thank you so much to my partners at Kenyan Nurse Consultants for being the on-the-ground team. Their operations are phenomenal. And if you want to talk about the knowledge and the efficiency, and most importantly, the support, because it is a long journey. It took me 36 hours to come from the United States to Kenya. And so how much longer will it take for you to come from your home country to the United States? It could take a long time. You could do it the long way, or you could do it the quick way. And so we want to offer you the fastest way to come to the United States through our amazing partnership. I want to say good morning to the team in ReMar. We have a lot of work to do as we've been entrusted with this amazing conference. And good evening to all of you in Kenya and in the other parts of Africa. Thank you so much for attending this training, this masterclass. It has been served. And I will close with these words. You can, you will, and you must pass NCLEX. God is good all the time, and all the time, God is good. Well, have a wonderful evening, you all, and I will see you soon. Bye-bye.